Hello, 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 and welcome back to the topic where we highlight Houston Community College, our students, our programs, and our reach into the community. I'm Dr. Darin Baskin, the Executive Director of the Weekend and Honors College here at HCC. We're here every Thursday afternoon when HCC is in session live at 2 p.m. on Facebook and YouTube. Follow us on social media as Houston Community College District and watch us on HCC TV via your local cable provider. February, very important month. There's a lot going on in February. What we're going to talk about today is just as important. It is Heart Health Month. And today we'll be looking at our cardiac health and the people who keep our tickers ticking. We're joined by one of my new favorite people here at the college, Dr. Lutricia Harrison, who is the president of the Coleman College for Health Science. Welcome back to the show, Dr. Harrison.
Hi, Darin. Thank you so much. I appreciate you having me here. I love you and I love being here. So thank you as my new favorite person as well.
Yes, we love it. We love it here. So you are the perfect person to have on this segment, being and knowing your background and your commitment to health here in the city and all around the nation. And now you bring all of that to us here at HCC. Give us an overview of the Coleman College and what we actually do over there.
Coleman College is the college for health careers. We are the only college in the HCC system that specializes in anything healthcare. So, anyone interested in any of our programs, whether it's nursing, whether it's respiratory therapy, radiography, sonography, any of those areas, any area in the hospital, we offer classes here at Coleman College.
See, that's amazing. And the good thing about it is you are located in the heart of the medical center, which gives you way more credence than some other schools can take credit for.
Absolutely. We're the only community college in the Texas world-renowned medical center, and we're very proud of that. And we're also one of the only two colleges in the Houston Community College system that offers a bachelor's degree. So a student can start here from a credential, short-term credential, and matriculate all the way up into a bachelor's degree.
Oh, see, I love it. That's perfect. So when we think about heart health, most of us think of heart attacks typically. Uh, is is that all there is to heart health, or what else does it encompass?
Heart health is so important, and this month of February is so essential to bringing awareness. So I'm honored that you all are doing this. No, it does not only encompasses a heart attack, but also a stroke. It also has high blood pressure as well as high cholesterol, or dyslipidemia is what it's called. So many other comorbidities impact the heart. So it's not just about a heart attack or a myocardial infarction, but it includes so many of the other areas that impact the heart.
Hey, and I'm so glad that you're explaining this to me and to the audience because it's very important to understand that heart health is just not about the heart. The heart affects everything else that is important to our life source. So thank you for sharing that. Now, there's always this debate between the health between males and females. We already know that men are likely to have heart attacks, but women are likely to die from them.
Yes.
Why is that the reason? And what are some major differences between male and female heart related issues?
That is a fantastic question, Dr. Baskin. And one of the things is that women, when we go through hormonal changes, menopause, pregnancy, those things, the decrease in the estrogen levels can have a profound effect on the heart. The symptoms of a heart disease or a heart attack is different in a woman than it is in a man. Men typically have the chest pains. You feel like something's sitting on your heart. You feel that pressure. They think it's gas. Where a woman's symptoms are going to be on the right side and not the left side. The heart is in the left side of the body. Well, a lady tends to have symptoms on the right side. It tends to have more back pain or tooth pain, and those symptoms are very different. So a lady may not know that she's having a heart attack, and they may experience what's called a silent heart attack, where they're having these symptoms and they don't know that they're having these symptoms, and it damages the heart.
Oh, wow. That's so depressing, being that a lot of those symptoms can be deemed as something else. Like a toothache can
Absolutely.
just be classified as a toothache when it could really be a heart attack. I'm glad we're having this conversation. This is so very important. And I hope everybody out there is listening and are taking heed to what we're getting from Dr. Harrison, because this is very important conversations. And then just leading into the month of February, we all know February is also Black History Month.
Exactly.
So let's look at African Americans have a higher rate of heart disease than the overall population. And we're not even that big of a part of the population within the country. So what are some of the factors that tend to feed into that?
Genetics, obesity, comorbidities such as diabetes, high cholesterol, menopause, those age, being of African American descent is a risk factor. So, with things that you cannot change your gender, you cannot change your race. Those things increase your risk of having a heart attack or a stroke by 4 to 8 times greater than some of our other counterparts.
Wow. 4 to 8 is not a number I think any of us want to be playing around with.
Correct.
Those are numbers that could be the deciding factor on whether you live or you die. And so it's important to have these conversations and to have clear conversations as it relates to the difference between males and females, and also between African American and other subpopulations that we have. So let me ask you this, because again, these are important conversations to be had. What programs do we have at Coleman that can support any of the related issues that heart disease brings on?
So awareness is key. Anything you should be aware of, you should know your numbers, but eating healthy. We have food pantries here that offers healthy food options for people who may need some assistance. You have the recreation centers where you can go and you can exercise. You have stairs in your buildings. You have the parking lots. That's a great place to park further away. So you have different opportunities and services and benefits that are here, but also just bringing that awareness and knowing your numbers is going to be key to maintaining your health.
Hey guys, you heard it here first from Dr. Harrison and Dr. Baskin. Take the stairs, park further away.
Yes.
Don't use the elevator. Visit the pantry.
Yes.
Eat healthy. We're here for you. We want everybody to be healthy. We want everybody to understand their numbers. We want everybody to understand where they are and where they fit in the disease that is heart health. And Dr. Harrison, you're one of my faves. I enjoy talking to you. Thank you for joining us on the show. When we come back, we'll find out how to reduce your risk and improve your heart health.
At Houston Community College, we make your lessons matter. Open the door to real-world education, where passions become careers. Find out more at hccs.edu and let your success take flight.
For more than a year, we have kept you informed with more than 500 remote episodes. But now we're back, bigger and better, with more news and more guests. Join us live every weekday at 10 a.m. on Facebook and YouTube, and on HCC TV at noon and 5 p.m. You can watch from anywhere. We go where you go.
Welcome back to the topic. We're observing Heart Health Month, February. February has a lot going on, and Heart Health Month is one of those major issues of discussion. Joining us on this segment is none other than the great Dr. Nicole Townsend, who is our Dean of Nursing and at the HCC Coleman College of Health Sciences. Hey, Dr. Townsend, welcome to the show.
Hello, hello. Thank you for having me.
Yeah, we're happy to have you at the college also. So welcome.
Thank you.
Yes. Listen, we were just talking to your president, and she gave us some great advice. She gave us some tips. She gave us some tools to use. She gave us a lot of stats that are very important to the improving our heart health. So make sure when you walk by her, you tell her I say thank you, okay?
I will. I will surely do that.
Thank you. So let's just start our conversation talking about our nursing programs.
Yes. Again, thank you for having me. So happy to be here representing Coleman College for this very important topic. At HCC Coleman College of Nursing, we are committed to preparing the next generation of skilled and compassionate nurses. We are currently offering an LVN or licensed professional nursing program where we are providing students with the foundational skills to enter into the nursing profession. That program is for 1 year. So in 1 year, you can obtain a level 1 certificate and go right into nursing practice. Additionally, I am in the thick of the planning stages of reinstating our Associate of Degree Nursing, which is our RN program, with the goal of it coming back stronger than ever. We anticipate welcoming our first cohort in the fall of 2025. And so our programs here, I'm really proud to be here because our programs really emphasize hands-on training. We have a beautiful cutting-edge simulation. It's not even a lab. It feels like you're in a hospital where students can have these experiences like they're in the hospital so that when they do transition to practice, they are very familiar with the equipment that's being used. They understand working with interprofessional partners such as radiology, pharmacy, sonography, all of those programs. So, and building that strong clinical partnership is important so that we can ensure that our graduates are well prepared and that they meet the evolving needs of healthcare.
Hey, listen, that's amazing because what you have done is you have convinced me to sign up for the LVN program. So listen.
Come on over. You can actually do our ADM program. August.
Hey, listen, I want to be part of that first cohort. Let's go.
Yes,
I mean, that's amazing. I'm so excited for what you're going to bring to the nursing program. And these students, I know they're going to go out and be great.
Yes.
And you know, it feeds right into this discussion on heart health, because in the segment before, like I mentioned, your president was talking about the things like the ethnicity, the family history, and obesity. These are things that a lot of times someone doesn't have control over.
Absolutely.
So how can we really impact our health if it's something that we can't truly control?
So thank you. That's a wonderful question. And she's absolutely right? We know that some of these risk factors like genetics, age, ethnicity, these are beyond our control. But lifestyle choices play a major role in prevention. And what we understand is that research shows that about 80% of the cardiovascular diseases can be prevented through diet, exercise, and other healthy habits, right? So even though you might be born into a family with these genetic disorders, lifestyle changes are your best bet. Also, medication compliance. We know that a lot of the community are not compliant with the medication. So, because a lot of people who are on medications for heart diseases, once they start feeling better, then they stop taking the medication. But what we know is that it's the medication that's helping you feel better. So please continue to take the medication. So that means these people have to make intentional choices that will significantly lower their risk of a heart attack or stroke or any other heart-related condition.
Hey, listen, you brought up a great, excellent point, because I think one of the things that we have to stress is when a health professional tells you something, it's probably best that you follow what they're telling you to do. Yes. and don't go on to WebMD and say, "Oh, I'm the doctor now." And so I think you drove that point right down center field. So that's great. And a lot of times we have to look at those key numbers like our blood sugar, the cholesterol, yes. Our blood pressure. Those are important numbers to look at.
They're very important numbers to look at, but what's more important is that you know what those numbers are, because we know that the American Heart Association releases this data that tells us from a healthcare perspective that blood pressures, they want them to be ideally, a lot of people hear 120 over 80. Well, really, we want it to be below 120 over 80, right? And when we're talking about comorbidities such as diabetes, we know that that plays a critical role in our heart health, right? So when you hear someone talk about blood sugar or glucose, for me as a healthcare provider, I'm more interested in what is your fasting level? What is your blood sugar level when you wake up in the morning? For someone who does not have diabetes, that number should be well below 100. Okay. And there's some people that think that, oh, if my number hovers around 100, well, we call that pre-diabetes. Okay. So we want those numbers to be below that. A lot of people say, they'll give you the number, but we're actually wanting those numbers to be below. Let me think about another. Your cholesterol. Cholesterol is a big one, right? That's definitely a silent killer. So we want that to be below, let's say 200 milligrams per deciliter, below that. So some of the things that we teach in nursing and healthcare is about good and bad cholesterol. Right? You may hear them talk about LDL versus HDL. LDL is what we call bad cholesterol. We want that number to be about below 100. And your HDL, think about happy. Your happy, your good cholesterol, we want that to be above 50 for women and above 50 for women and above 40 for men.
Right.
So there is a difference.
So, I mean, again, you're dropping, and I love someone who can teach me something along the way as we're interviewing. And these little nuggets of information are so very important. But let me ask you this, because you have the knowledge. How about you share with us, what are some good resources if I would like to learn more myself?
So I would say on the local level, if you wanted to get some, obviously any of your local hospitals and your heart centers, they're great. Texas Heart Institute, Memorial Hermann, Heart and Vascular. But in the community, obviously I did mention the American Heart Association. Well, there's a Houston chapter. And I think you can go to www.heart.org and get some free information out there. Harris Health, always a wealth of information. They do free heart screenings. They offer low cost screening, sometimes free, for blood pressure, cholesterol, and diabetes in their community centers. There's so many. The City of Houston Health Department, that's a great one. Your local YMCA. A lot of people don't think about that. Houston Parks and Recreation, they do offer, because I participated in them, they offer free and low-cost fitness programs, walking groups, anything like that. Any heart health resources, you can attain those for free.
And you throw us right into the next segment. Dr. Townsend, this has been an amazing conversation. I appreciate you. When we return, we'll learn how HCC provides opportunity to get your heart rate up.
Thank you so much for having me.
At Houston Community College, we make your lessons matter. Open the door to real-world education, where passions become careers. Find out more at hccs.edu and let your success take flight.
When I was your age, I was just like you, fascinated by stars. But now I get to search for life in the universe. And who knows, maybe life is looking for us too.
So we're like aliens to them?
Yeah. Does anyone want to be a scientist now?
I do.
Awesome. We need more girls in STEM.
Maybe we can find aliens.
Things could be stranger, but I don't know how. I'm going through changes, through all of the strangeness. I'm going through changes now.
Hello, and welcome back to the topic. So at the top, I failed to mention that we are in the studio, and the studio looks amazing. So I am so excited, so happy to be joined in the studio by none other than Tiffany Lane, who is our program director of our HCC Recreational Sports. She's going to tell us how to get our heart rates up and how to get moving, because we've gotten a lot of medical. So now let's talk about how we can impact our bodies.
Thanks, Darin. Thanks for having me.
Yeah, perfect. So let's just talk. Let's just have conversations.
All right.
Okay. So what is the mission of Rec Sports here at HCC?
Well, our mission is to provide different programs, services, and facilities that impact our health and well-being, our physical, social, and our lifelong abilities, our lifelong health. So, which is related to health, wellness, and then recreational sports.
Hey, I have been around this place for a long time.
Yes, you have.
And I remember when we didn't have Rec Sports.
Mm-hmm.
I remember starting Rec Sports, and I remember working with the teams as we were putting Rec Sports together for the students. So I can appreciate the work that you do and all of the influence that Rec Sports has here at the institution. So explain to everybody, how are Rec Sports organized here at the college?
Okay, great question. So recreational sports, as you know, HCC is a community college system made up of 7 colleges. And so we have a recreational sports specialist at each of those campuses that help program and provide opportunities for students to get active, whether that's socially, physically, or for mental well-being. And so with that, we offer different program areas, whether that is our intramural program, where our students get to compete against one another in one-day tournaments, whether that's basketball, soccer, Uno. And then we have informal and open recreation, where you can just kind of drop in. There's no set schedule. So you come into the fitness center, or you're going into one of the rec rooms, and you're just passively playing ping pong or air hockey. And so then we also have fitness and wellness, where you have the fitness centers, as mentioned earlier, and then also our wellness workshops, whether that's on healthy eating, meditation, and things of that nature. And we also offer outdoor recreational opportunities, whether that's like rock climbing or just getting outside and walking, getting in touch with nature. And then our special events, that could be where you're going bowling, ice skating, roller skating, or even to a sporting event that we sometimes offer our students. And then, of course, our club sports. And so that's our most popular program area.
Well, hey, give us a little bit more about club sports.
So currently we offer men and women's basketball, men and women's soccer, tennis, which is co-ed, and then right now women's volleyball and baseball. So we're bringing baseball back. So those students get to compete. We have eligibility requirements, where you have to be taking at least 6 credit hours and maintain a 2.0 GPA, be good in good academic standing. So those students in the club sports, they practice twice a week, and then they participate in leagues and games against other colleges and universities here in the city and the region.
That's amazing. And so I hear from a little birdie
Mm-hmm.
that there's something called esports, and it's becoming so very popular. So, and I hear we have a tournament coming up. Tell us about it.
We do have a tournament coming up. See, I am not a gamer, so I went out and I hired a student to help me put these activities on, and he's doing such an amazing job. And so next week we're offering a tournament, Apex Legends versus Fortnite. And we have a Discord, an active Discord where students can to join, and then that's where those activities are hosted. And we are hosting one every month at least. But then we also have some events on campus. So at our central campus next Tuesday on the 18th, you'll be able to participate in NBA 2K, Mortal Kombat, or Mario Kart. And then I think at Central, after spring break on the 17th, they're having a gaming tournament as well. So we're trying to cover all aspects, whether you're online or if you are in person, for that opportunity to participate in esports or gaming. Oh, I also want to mention that at West Loop, they have a rec lounge now, where you can just kind of walk in, check out the equipment, and you're able to work out. So that's West Loop C140, by the way.
Oh, wow. I love that. Let me just say, I am not a video gamer, but I got the handheld one, the Nintendo Switch. And one of the games that I play religiously is golf.
Really?
That thing keeps you in shape. That golf, hitting that thing and moving and doing all the movement. So I totally understand how that could be a heart healthy game.
Absolutely.
And these tournaments are right in the wheelhouse of a lot of our students. So that's amazing, amazing. So I know that you guys are also hosting some financial wellness seminars. Tell us about that.
I know a lot of times people hear recreational sports and they automatically think sports, but we offer way more than sports. We subscribe to the 8 dimensions of wellness, and we are highlighting a wellness dimension every month. And February happens to be our financial wellness month. And so throughout our system, we have some wellness classes and workshops, and those are taking place next week as well. I don't have the exact dates, but you can always check us out on social media and the website for that information.
That's amazing. So, and that brings us to this National Recreation Sports and Fitness Day. Tell us about that.
So, Houston Community College is an institutional member of NIRSA, which is National Intramural Recreational Sports Association, and they are the leading association in terms of campus recreation. And this association started on February 22nd. So that is the day that we recognize and celebrate campus recreation across the country and abroad. Actually, we have institutions in Canada and other countries as well. And so we will be participating in various activities. There's going to be a walk challenge at Central and at Katy, Spring Branch, A-Leaf Hayes, and then Stafford. There's going to be plenty of activities as well as Eastside. So we have a lot of activities that are going on next week in our short week, right? And so it's going to be very fun for us to celebrate and always and highlight the campus recreation that we do and activities that we do here at HCC.
I love it. I love when we have so many activities for students to choose from that they have choices.
Yes.
And I can appreciate that. And I know students appreciate that. So great job getting your team together and putting them to work. I approve.
Great. I'm glad you approve.
So listen, before we wrap up, tell us and the audience, how can we get more information about everything you just said? I heard you mention social media. Give us some sites to go to. Give us some websites.
Right. So, of course, you can go to the HCC website. And so that's, just go on the HCC website and search Rec Sports. That'll be the quickest way to find it. And then we also have Instagram and Facebook. And so if you're interested in the activities that are taking place on the campus, whether in various areas across the city or across the system, you can go to HCC_Rec Sports. And that is for Instagram and Facebook. And then for club sports specific information, whether that's for tryouts and game dates and times, is HCC_Club Sports.
Wow. Amazing. Great information. All I can say is HCC, let's get active. Yes. So thank you for joining us today on the topic. Thank you, Tiffany. Such great information. If you enjoyed the show, follow us on Facebook and YouTube at Houston Community College District. To listen to the topic and more HCC TV programming, visit hccs.edu/podcast. For the topic at HCC, I'm Dr. Darin Baskin. Until next time.
(150/90).
180/111.
160/110. I had a stroke.
Your blood pressure numbers could change your life. Lowering them could save you from having a stroke. If you've stopped your treatment plan, restart it or talk to your doctor about creating one that works better for you. Start taking the right steps at manageyourbp.org.
Now I'm, trying to get better, stronger than ever.